Hi, I'm Chen Lee Holmes Liu. I'm an Associate Professor of Medicine at the University of Adelaide, and I'm one of the lung transplant physicians at the Royal Adelaide Hospital. I'm also the Head of Training and Education in Thoracic Medicine, so I teach all of the junior medical staff, ranging from medical students and interns up to advanced trainees, about lung transplantation from the clinical point of view, but also the important systemic issues that they need to know moving forward.
I'm Mark Holmes. I'm the head of the South Australian Lung Transplant Service, and I'm a Professor of Medicine at the University of Adelaide. And my main role is obviously to see patients who might be potential transplant candidates or who've had transplants, and also to deal with the administrative functions of the South Australian Transplant Unit.
So specifically for people in South Australia, I think it would be great if they knew about the path to transplantation from a medical point of view, of course, in terms of what it involves and the medical testing that's needed, and obviously from a unique South Australian point of view, the major role of the lung transplant unit here in terms of facilitating their care before transplant, and also getting them across to the surgical centre in Melbourne or in Sydney. And I think that the more that they know about that process, the easier it will be for the patient and for their families, because then they can have a good idea about what the road ahead will entail, but also what supports might be needed in terms of getting them to Sydney or Melbourne.
I think that they should know as much as possible about transplant and the process, what they need to do to get to the point of having a transplant, and what might be the outcome after a transplant. So I think it's important that they ask for as much information as possible, that we give as much information as possible that's easily digestible, that and hopefully they don't rely on what they read in the internet out of context. So I think that everything they learn they should put in context by asking, hopefully us, so that we can help in that way.
It's really good to be able to prepare mentally and to prepare the family mentally the more that you know, and so I would really like to encourage everyone to ask as many questions of us and of the rest of our team. There's no such thing as a silly question. We've heard almost all of the questions that you could think of before, and we really like new questions because you know, if you may be the first person to ask it, but you will never be the last person to ask it, and it helps us to know what worries you and what you need to know as well from a transplant point of view, so that we can help to make sure that the road ahead is as comfortable and positive as possible, because we're aware that it's a very trying time and a stressful time for the patient and their families, and so I think the more information that you get, the better it is for everyone. So.
It'll be different, a different regimen, and as complicated as one can be, but having said that, almost all patients cope very well with it, with that aspect. They can expect to have very close follow-up and caring follow-up from our team and from the interstate teams, and they can expect in general a vastly improved quality of life, length of life, capacity to interact in the community in a normal way.
Other things I think would be important to know for the road ahead is that you have new lungs, but you don't have new legs or new muscles, and those muscles haven't had to be used when your lungs have been weak, because mostly you couldn't push yourselves too much because of your lungs, but then now the lungs are not a major limitation anymore. It takes a little while for the rest of the body to catch up, and also for the brain to catch up, because for a long time you've been dealing with a chronic illness that hasn't that has limited life and in terms of what you can do, and all of a sudden you're not a really sick person anymore. You've got a different role where you might look after someone rather than them looking after you, or you might be thinking about getting a job or doing all those hobbies, and so the road ahead is getting used to all of these different things from an emotional, mental and a physical point of view. There's
been a gradual improvement in length of life after transplant, but not as quick as we would like. Transplant is the most complicated solid organ to deal with. The lungs are very complicated, they're open to the environment, and so they need a lot of immunosuppression, and so for that reason the outcomes aren't as good for say as kidney or liver, but they are still improving all the time with new drugs for immunosuppression, new approaches to surgery, certainly new approaches to the very early management when they're in Melbourne or Sydney. And then also, I think, improvements related to how teams work. You know, who has involvement with the coordination of their care and the input of psychology and social work, specialist infectious disease input and specialist input from renal, diabetes. And so we develop the relationships with all the subspecialties in those areas where we know our patients might get into trouble and that they'll need expertise at that level.
So medicine is really all about experience, and so the more patients that you see as a group, so not so much as an individual doctor or team, but in terms of international experience, the more patients that have the treatment, then the more we're going to learn about that. And so from a transplant point of view, because the numbers have increased so much over the last decade or so, we've learned many things about increasing, for example, the donor pool. So right from the beginning of where it all starts, the donor pool increases, and there are new surgical techniques which have made the transplant surgery easier and more streamlined, but also have enabled people who might not have been able to have a transplant before because of technical issues now are able to have transplants. Of course, there are many new drugs available in terms of immunosuppressants and antimicrobials to prevent or to treat infections, and so there have been a number of advances from that point of view. The things that we would really like to advance, I think, are the treatment of rejection, and in particular chronic rejection, which is the major limiter from the point of view of the survival of the lung transplant graft. And so that's been a little bit slower to improve on an international scale, but there's a lot of research going on to try to improve that, including in Professor Holmes's lab, where we're looking at the very basics of what causes rejection and how to then try to prevent that and treat it. It's really important to get the message out there that we need as many donors as possible from a lung transplant point of view in particular, but that also I think it may be well known that one of the barriers to organ donation is people not discussing it with their families, and so many of you watching this may be organ donors, but please have the somewhat difficult discussion with your family members so that they know to fulfill your wishes should the worst happen. Because it is an awkward discussion, and we all realise that no parent or loved one wants to ever think about what would happen if a potential donor was in an accident. But if you don't discuss it, then you may not be able to become a donor, and so I'd like to get that message across as much as possible.
I think organ donation can change lives, not only for the recipient and obviously their family, but you can look at donation as also being important for your life and your family. So if you're in the tragic situation where one of your relatives is such that they won't survive, but they can be organ donors, then you can see that as a positive and a gift to give life to someone else. And I think that as a donor, you can't underestimate the impact you're having on someone's life and their family. And so I think that's how I would think that people could look at donation as a positive in a situation that's often very emotional and traumatic and negative in many other ways.